Hello, and welcome to the Baker Senior Show. This show details everything about Medicare. If you have questions, please let us know. We are live every Tuesday morning at 8 o'clock Central Time, and we're bringing to you the information that you need to take care of yourself and your family members. Anybody that's turning 65 needs to know this information. And for those of you who have passed the age of 65 and you've been on Medicare, you also have some choices to make. And Steve Baker from the Baker Seniors is going to tell us all about it. So we encourage you to ask questions. We have a lot of experience with Medicare, but there's always something that we can learn, right? Good
Correct.
morning, Steve.
Good morning.
So I understand we're going to be talking about the 9 essentials for people turning 65 today about their Medicare.
Correct.
All right, let's dig in.
Well, I was reading an article this week, and a lot of this stuff I've covered, but the article I read had a concise list of things that people really need to know when they reach the age of 65. And whether they're going to actually take Medicare at age 65, they still need to know these things. So I want to review them one by one, and so they'll have it. And then when the time comes, whether it's a year from now or 6 months or 3 months or whatever it is, you'll have done at least the background of things that you really need to be aware of when you turn 65.
And probably you need to be aware of them before you turn 65 so that you're not confused when it all comes down on you.
Right. Exactly.
Okay.
So the first thing you need to know is that you need to know to pay attention and be aware that you need to enroll on time if it applies to you. A couple of things that you need to know is if you're going ahead and getting on Medicare at age 65, then you need to go ahead and get your A and B. And two things about that is if you're taking Social, because a lot of people can take advantage of Social Security at age 62, and some people do that. And if that's the case, then you will automatically receive a Medicare, what we call the red, white, and blue card, with your Medicare number and the eligibility date that you have, the first month of your birth date. So you'll receive that automatically. However, if you're not taking Social Security, you will more than likely receive a card with just the A on it, which means that you'll need to go ahead and apply for B at the proper time. And you have 3 months prior to your birth date, your month of your birth, and then 3 months after, which is a total of 7 months that you'll have free to go ahead and apply. After that time, there could be some complications. So 3 months before your birth month, your date of your birth month, and 3 months after.
All right, Steve, let's recap that because it sounded a little confusing to me.
Okay.
So you're saying you need to pay attention to your age and your date of your birth because you have to enroll in time or you have consequences.
Correct.
So we don't like consequences. We want to make sure we do the things that we need to do and do it on time. So you're saying we can learn about what we need to learn about, and 3 months before our birthday, we could start this process so that we don't lose out, just in case, because things happen. Look at what's happening right now. Everybody's all in a tizzy because we're on lockdown. No one's going to work and all these things are happening. So if you start 3 months before your birthday, then you have a little grace period, right?
Exactly.
Okay, good.
Exactly. And
so
then
you're saying, wait a minute. So you're saying that if you're on Social Security, it's an automatic thing, or just sometimes it's an automatic thing?
Well, what I would say is just look for your A and B card in the mail. Nothing's perfect, so sometimes it's overlooked, and you're going, I didn't get my card.
And
So
you should get
then,
your card by your birthday?
yes,
Okay.
yes.
So if your birthday comes and goes, you're on Social Security, and you haven't received a card, you need to do what?
You need to call Social Security and get your card. Not
Oh,
Medicare, but Social Security.
really?
Uh-huh.
So they are the same, Social Security and Medicare?
No, they're not the same. But for some, I don't say weird, but for some reason,
You can say it. Our government is a little catawonky.
just suffice it to say, or you can go ahead and contact Medicare,
Okay.
but they will refer you over to Social Security.
Okay.
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 So just make sure that that you have your card if you're going to take advantage of the full-blown Medicare. If you're not, if you're going to continue to work, then make sure that you do not apply for Part B yet. Only later, whenever you're ready to go, will you apply for Part B.
I think if you've been watching our show, I think that you're going to see that it's time for you to call and ask Steve your personal details, because this sounds very confusing and it depends on your situation, because Medicare is not black and white. It's not you go in and you enroll and everybody's the same. If you have this circumstance, then this is what's going to happen. If you have pre-existing conditions, then this is what's going to happen. So are you available to answer those calls?
Certainly.
And help them figure out the best way to handle it? Okay, good.
Yeah.
Because I know you're explaining it and you're doing a really good job, but everybody's circumstances is different. So I want people to know, and I'm going to put your phone number up here, that they can call you to get the right answers to their questions.
Great.
Okay, so pay attention and enroll on time.
Great. Secondly, you need to know the ABCs of Medicare. ABCs are, the reason they call them ABCs is because there's actually A, B, C, and D of Medicare. In Part A, I think we've talked about this quite a bit in the past, but Part A of Medicare has to do mostly with your hospital room when you're entered into a hospital for any purpose. So that's taken care of. And typically, ABC is not free, but you've already paid for it through the years. When the payroll deduction has been made into Medicare, that goes to take care of A. So there's a rather large deductible for A, but if you've acquired a supplement, that's all taken care of in your A as well. And B is everything else. B is your doctor's visits inside and outside of the hospital, all your MRIs, CAT scans, blood work, everything that's involved in making a inquisition about your health in your health care is paid for through B. C is the Medicare Advantage program. And in some cases, that will apply to people if they're in a certain situation. The Medicare Advantage program could be beneficial. And D is the prescription drug program. So
that was very clear. Thank you very much for explaining that. I think we should explain that every time, because we've been doing this show for a while now, and I was still unclear because there's just so much information that you're trying to give us. So the way you did the ABCs, that was great. Thank you. Perfect.
Correct. Secondly, you have to be aware of what Medicare doesn't cover. There are quite a few things that come up in the discussion. One is dental. It doesn't actually, in 98% of the cases, it doesn't cover dental. It
So
doesn't
what does
cover.
someone do if they are age 65, they have no health insurance except for Medicare, and they
Mhm.
need dental work? What do you have anything for them? Do you have any?
Well, yes, you can acquire a separate standalone dental policy, which it's not hooked to Medicare in any way, shape, or form. It could actually apply to anyone under 65, not on Medicare, but you can get a standalone dental plan. There are numbers of them out there, and I could help guide you to the right place for that.
We do
If
need dental care.
correct,
Is there
correct.
a
So
reason why Medicare doesn't cover dental?
it was the way it was set up way back in 1965, before most of the people who were eligible were even born, but not really, because eligibility, as we're speaking right now, started in birth year 1955. But in 1965, Medicare was initiated, and so they just set it up that way, and that's the way it is. That's the way it's been, and there's no vision into the future to change it. So there you are.
So no one has said we need to change Medicare and cover some of these things. They just know that you have to get your own dental.
Correct.
Is there anything else that doesn't cover?
Vision,
Oh no.
vision.
You
only,
can't see and you can't eat, what's the sense?
only, only in the case of if you have some cataract surgery. Yeah, cataract surgery is covered. So, and then you're allowed a pair of glasses. So, and those in that instance, yes, but otherwise, no. So you
Okay.
need to be aware of that. I know of a policy where what's called dental, vision, and hearing. Hearing is another issue. So we call it DVH, dental, vision, and hearing. So there's a nice policy available for someone to take care of those three items, aside from Medicare presently.
So if you needed a hearing aid, Medicare is not going to cover that.
Right, right. So also now, what Medicare does cover, it covers a lot. I mean, it really does, especially if you're talking about major things. I've been on Medicare quite a few years, and so has my wife. So we're pretty well taken care of in terms of also office visits, any kinds of tests that are done inside and outside of the hospital. Inside or outside of the doctor's office, and all of that's take X-rays, as I've described, MRIs, and that sort of thing. So also, the next one is that Medicare is not free.
What?
No, it's not free. As a matter of fact, there is now when I say free, people means you don't pay, but in the incidence of Part A, it's already paid for. So in a sense, you've paid for it. So you might say by a stretch that it's free, but you've already paid for it. B is the big issue. There's actually a premium for that. And typically for people, unless you're making a whole lot of money on an annual basis, typically it's $144.60 this year for the premium. So it's typically taken out of your Social Security check, so you don't even see it. It's paid for. So
It's paid for, but it's not free.
that's correct.
You're going to pay for it one way or the other.
That's correct. That is correct.
Here we were thinking that our government was going to take care of us when we got old, and it's just not true.
That is right.
Darn.
That is right.
Darn.
And then you've got to be aware that there's a one-time deductible of $198 that takes place. That's called a Part B Medicare deductible of $198 that must be met before Part B kicks in. It's not a lot, but it's some, and you have to be careful about that and be aware of it as the year starts, starting January 1st of each year.
Okay, so every year, not every month, but every year, you have a deductible for your Medicare Part B.
Correct.
Okay. Whew, you are laying a lot of stuff on us. If you're listening to us today and you have questions, Steve is more than willing to talk with you. We can talk with you on camera. You can type in your questions on the side. We are live on YouTube and Facebook every Tuesday at 8 o'clock. And we have a half an hour with Steve to talk about all things Medicare, what it covers, what it doesn't cover, how to get through all the confusing jargon that they use, the words that they, throw out there that we don't understand because we're not in the business. But Steve is, and Steve's been on Medicare for many, many years, so he can answer your questions. If
Don't
you
say,
haven't,
yeah, don't say many, many years. Just say many years.
okay, many years. For some years, there you go.
A few years. Let's put it that way.
And he's been a Medicare professional for many years, right?
Many
Oh,
years.
many. Now we can go to many. All right, good.
Correct.
He has a lot of experience with people that have gone through issues that we could talk about. There's a lot of different things that Steve has encountered with his clients that we could talk about. All right, so we covered pay attention, enroll on time. We've talked about the ABCs of Medicare, what Medicare covers, what Medicare doesn't cover. What else? Oh, that's right. Medicare is not free.
That's correct. Medicare is not free. Exactly.
All right. What else do we need to know?
So you need to understand that that there, I think we've explained numerous times that there are two kinds of Medicare. One is traditional Medicare with a supplement, and the other is Medicare Advantage. With the supplement, Medicare, original Medicare with a supplement, there are actually no networks, no doctors' networks. In other words, you can take 98% of the physicians and all 100% of the hospitals take traditional Medicare with a supplement. And so you can go in and not be part of a network, and you choose the doctors you'd like to see. And if you're not happy with one, you just simply go to the yellow pages, or these days you go to the internet and choose another one, and go ahead and call and make an appointment and tell them that you're on original Medicare with a supplement, and Zoom, you're in. So there's actually no network on that side. On the Medicare Advantage side, there is a stringent network in a lot of cases. So you must have what's called a PPO, or a preferred provider for your Medicare Advantage, and that person kind of guides you and directs you and able to refer you to other physicians in case you need to be so. But you need to stay with that one doctor, and that's called your network or PPO. So that's important to know.
Can you give us an example of that? That seems a little confusing. Can you give us an example of somebody that you've worked with to give us a little more clarity about what it is that you're talking about?
Yes, I can. As a matter of fact, you and I know of a person that I've helped, and she happens to be in a living facility, and the doctor, the preferred provider, actually comes by and visits with her, and she sees the physician sees other people in the facility as well. So that's her person. That's her preferred provider. So that's the person she's in the network with.
So what happens if she's on Medicare, which she is? Mm-hmm. Okay, so this is a really good example. All right, so this woman, and her sister's given me permission to talk about it. She has Alzheimer's. She's living in a personal care home, not one of those big monster places, but a home that somebody turned into a personal care home. They are licensed up to 9 people. And everybody there has some form of dementia. They're not all Alzheimer's, but they can't remember much. So the doors are locked and everything is provided for them, including the doctor coming to the house to visit everyone. So
Right.
everyone
And
happens to
yeah,
be there.
yeah. And the official name of it is assisted living. So it's an assisted living facility is what that is.
Hmm. And
So,
it's also known as a personal care home because it's much more personal than I think these big buildings that you see.
mhm,
I'm I'm sure you've seen them. They're
sure.
huge and they have lots and lots of stuff going on. They usually have different departments for different things.
Hmm.
So this particular lady is on Medicare. So what does she have? Does she have an advantage? Does she have regular? What does this woman
She has
have?
she has advantage.
Okay.
So
Now
so
that
her so
okay,
so
go
her
ahead.
so her personal physician, which is her preferred provider, comes by on a regular basis every 2 months or 1 month or whatever it is, and visits with her along with the other residents there, and goes over her program, her medications, and so forth. So, and then she visits them one by one. But if she had an occasion, or if she wanted to, or her overseer wanted to change, she would have to go out and seek another primary care physician. Call them they call it
Okay.
PCPs,
All right. So
primary
so
care
far
physicians.
everything has gone along just fine and she's seeing this doctor who's coming in. What if something were to go wrong, like she fell and she needed to go to the hospital? Then what?
Well, she would be sent to the hospital, and the PCP would designate which hospital she needs to go to. And so, in an emergency, a real emergency situation, she could go to any emergency room that's close by, and the Medicare would take care of that. But then ultimately, if she needed to be hospitalized, she'd go to the facility that the PCP provides for her.
Okay. All right. Okay. Thank you for giving us an example. I think it really helps to understand. If we can come up with another example for our next show, I think, a totally different situation, someone that's not on Advantage, maybe we could talk about somebody. You don't have to mention any names, but I think an example is good.
Hmm. Sure.
Okay.
I
What's next?
Well, there's actually Medicare serves under 65s. A lot of people don't know that.
No, we didn't know that.
If you're not 65, and there's certain circumstances where that person, if if they're disabled, if they actually have Social Security disability, after being on disability for 2 years, then Medicare will come in and provide underage Medicare for them, and that's a special program that not everyone can qualify. Is 30, 35 if they're disabled because of an automobile accident or a major fall, industrial accident of any sort. Those people ultimately can end up on Medicare and be years away from age 65. So that's a specialized program that a lot of people don't know about, but it's important to know that after 2 years of Social Security disability, one can qualify for Medicare.
Very interesting. Okay. Now, does that also include people with disabilities that they were born with?
Yes,
Okay.
yes,
So you could literally be on Medicare at age 8.
correct. You can
Okay.
do that. You can do
Okay.
that.
All right. That's
But you've
interesting.
got to go through the Social Security disability program,
Right.
and then they can direct you into whatever you need to do to take care of that.
Okay. All right. And would you be able to handle that, or do you only handle people that are 65?
Well, when you say handle, I can direct them in the right direction and help move them through the process. Yeah.
So you
So
don't set them up with Medicare in that
no, well,
circumstance?
no, not really. No, it's all done by institutions and so forth and agencies. But
Oh, okay.
I can direct them and move them in the right direction, move them
Okay.
along.
Okay. So for those of you who are listening on our podcast, let me give you Steve's phone number again, because I know it's important. When you need this information, you need to talk to somebody who knows where to send you, how to discuss the different things. Steve is very, he can be very private about your circumstances. You do not have to worry about when you call Steve if he's going to go blabbering this information all over town. It's very confidential. You just call Steve Baker at 832-754-3292. And he can talk to you about any question that you have concerning Medicare. Whether he can help you personally or not, he's going to direct you to the right phone number or the right website or the right person that's going to be able to help you in your circumstances. Isn't that right,
That's
Mr.
correct.
Baker?
That is correct.
All right. So once again, his phone number is 832-754-3292. And we're here live every week. If you'd like to come in, you can ask questions on our sidebar. We're on YouTube. We're on Facebook. We're live, and we would be happy to answer your questions right here while we're live. Or if you submit your questions ahead of time, we can answer those questions next week. All right, Steve, what's next?
Well, the last thing that was mentioned in this article is that everyone should be aware of Medicare and what's available, and you really, honestly, have to be a student of Medicare. You might as well accept it when you're approaching age 65, unless you're on early age disability or something. When you're approaching age 65, you really do need to be educated about it, because it will allow you, if you're educated, it will allow you to make the most of Medicare. And the problem with that I've seen over the years is that people deal in rumors. And if you've got a circle of friends or whatever, well, my friend said this and so, and then my other friend said that, and so forth. And you really need to go ahead and get involved and get somebody who can help you and explain where you are and your options. And by doing that, you can make the most of Medicare. There are lots of different directions you can go, and you just need to make sure that you're in the right direction. Because there's something that's called open enrollment, and what we've talked about in that open enrollment period, there's actually 6 months on either side. This is different from what we were talking about earlier, just to add a little confusion to it. But what we were talking about is 6 months on either side of your 65th birthday is the open enrollment period. And in that period, you do not have to answer the health questions when you sign up for the supplement programs.
Why is that?
So what's
the reason behind that?
It's just the way it is, and the way I'm kind of being facetious about it. And someone says, "Why is the sky blue?" I don't know. I don't know. It's blue. Okay.
Oh dear.
But there's also a publication, a very famous publication out there called Medicare in You, and I was looking through it just last night, and there's a lot of stuff in there that, even though it's published by the Medicare.gov people, it's still quite confusing. So you really do need to, even in that instance, you need to have somebody to help you and guide you. But the verification is there in Medicare and You, and each year they publish a new one. So right now we're working on Medicare and You for 2020. And sure enough, as the sun rises, there will be a Medicare and You 2021.
Okay.
And there'll be a few changes and so forth. And
Okay. So our
That's the
government at
program.
its best. All right, there we go.
That government
Well,
has its
ladies
best.
and gentlemen, thank you for tuning in this week. We appreciate you. We want you to know we're here for you. Steve is so kind and available. You don't find that every day. Someone who's willing to pick up the phone and talk to you about your personal experiences and your questions. Give Steve a call at 832-754-3292 and get your answers today. Thanks again, Steve, for all your help. We'll see you again next week.
Thank you.